You're about to discover why your healthcare costs threaten to bankrupt you and your family. This is an overstatement. None of this is sensationalized. The sources relied upon in our Healthcare Sucks include leading medical journals. Here's what one of them, Dr. Marcia Angel, former editor of the New England Journal of Medicine, has said. Quote, healthcare is directed toward maximizing income, not maximizing health. Dr. Victor Montori of the Mayo Clinic went even further. Here's what he's had to say. Healthcare has become just another industry. We need a revolution. And he's right, because we can no longer afford looking the other way while doctors deceive patients into accepting risky procedures they don't need. Medical bills already cause twice as many family bankruptcies in America as all other causes combined. And with more medical costs being shifted to consumers, you can expect your own healthcare costs to triple over the next decade. Our medical spending is so out of control because much of it is fraudulent. The top 10 fraud settlements in 2010 were all with healthcare companies, and 80% of all fraud settlements in 2010 were with healthcare companies. 80%. And it's not just corporate fraud, but the routine soft fraud going on in doctors' offices and hospitals across America. Our Healthcare Sucks explores this dark underbelly of our healthcare system, so you can know what to look for and how to avoid being exploited. But unless you learn what to look for in your medical care, you could be risking more than your family savings, because these deceptive medical practices cause needless harm and even death, which is why I call it predatory medicine in our Healthcare Sucks. This book will cause you to rethink your healthcare and help you protect yourself and your family from medical exploitation. You'll learn the true extent of harm from unneeded procedures, why doctors do the things they do, and what you can do to make sure your family's in the care of the best doctors, and not the growing ranks of unethical doctors whose priority is padding their incomes at your expense. You'll also learn why health reform may do more harm than good, and it has nothing to do with socialized medicine, and what hit-and-run medicine is, and how it threatens you and your family. And most importantly, you'll learn what you can do to protect yourself and your family, and your family savings. Get your copy today so you're not left unprotected any longer, because you won't hear about this in the mainstream media, and you desperately need to hear it. My name is John Lynch, and I researched and wrote our Healthcare Sucks. I've had decades of healthcare experience as a hospital administrator, planner, consultant, entrepreneur, and consumer advocate. The company I founded and took public was twice named to Business Week's Best Small Companies in America. And I've spent the past decade researching what's really wrong with America's healthcare system. What I've learned may shock you and open your eyes to both threats and opportunities. Don't you owe it to yourself and your family to learn how to protect them from these threats to their health, safety, and finances? And how long can you afford to remain at risk for medical exploitation and endangerment? Our Healthcare Sucks will help you spot the medical scams and learn how to defend yourself, because no one else will.